Hello, I'm Dr. Aditya Kashikar, consultant spine surgeon with VR Spine Group. We have seen often that fast bowlers they break down very frequently because of some or other back related issues. Why do they get such injuries every now and then? If you see their career uh, path also, maybe right from their adolescent age group under 19 days also, they are doing this bowling action for so many years. The bowling action itself, it's quite impactful action where you have to run fast, and with impactfulness you have to do this movement where you are straining your back quite a lot. Whenever these actions are happening, they cause microtrauma on daily basis, whether they are doing it once or they are doing it repeatedly. Each and every time that microtrauma is happening at the spinal level, at spinal vertebral bone level. Whenever these stresses are getting impacted on spine repeatedly, obviously they are going to cause issue, or they are going to show its effect in a longer run in a cumulative way. So that's the reason when these impactful things happen quite often. So you have seen that many times whenever there is longer international tour of any fast bowler, and if that fast bowler is involved in, let's say, one day cricket, T20 cricket, and also test match cricket, by the end of that tour he'll start getting some back pain related issue, because that continuous activity he is doing that for 1.5 months continuously, and there the strain gets more, and that aggravation of symptom and inflammation happens. We have seen that with these repeated actions, sometimes they come with stress fractures of their vertebral bones as well. So depending on the type of symptoms a fast bowler coming with, or the disability what he is presenting to us, depending on his symptoms and the radiological pictures, what X-ray, MRI, CT scan, and sometimes we carry out bone scan also, just to know whether that stress fracture is acute or inflamed. To know the status of that, we sometimes carry out bone scan as well. So depending on the type of all these factors, we chart out a plan of action for them, where sometimes we give them rest for a certain period. We can offer them anti-inflammatory muscle relaxant. We can offer them pain management sometimes. And in rare instances, if symptoms are quite disabling one, then one may offer them surgery as well, but which will be the last option. So with so many league matches or country related matches, and these league matches are happening all over the world, the more and more these fast bowlers are getting involved in these matches, they are bound to have these stress fracture related issues in cricket. So as and when things happen, they need to approach nearby orthopedic or orthopedic spine surgeon. Thank you.